And now our featured presentation, IT Security Threats and the Protection of Your Personal Health Information, brought to you by the Georgia Health Information Technology Extension Center. You can learn more about Georgia HITEC by visiting www.georgia-hitec.org, and you can also follow along on Twitter at Georgia HITEC. So just a little bit about Georgia HITEC. It is Georgia's only federal and state-endorsed expert to assist providers in achievement of meaningful use EHR technology. Georgia HITEC is located at Morehouse School of Medicine's National Center for Primary Care, which provides support for primary care professionals serving in underserved areas. You can learn more about the National Center for Primary Care by visiting www.primarycarematters.org and on Twitter at PriCareMatters. Our presenters for today will be Mr. Robert Morris. He is the Vice President of Operations and Product Development for the ION IT Group in Franklin, Tennessee, and Ms. Phoebe Nelms. She is the Assistant Program Manager for Georgia HITEC Technical Outreach at the National Center for Primary Care. And just a quick note that in compliance with ACCME guidelines, the following speakers have no financial or other relationships with the manufacturers of any commercial services discussed in this educational activity. Today's webinar objectives include to discuss the details of select PHI security breaches that have happened in 2017, to critique the essential elements required to help satisfy the administrative safeguards of HIPAA, to evaluate how to help determine if a PHI breach disclosure has occurred, to analyze how to be better prepared to protect and recover from malicious ransom and malware attacks, and to assess the steps required to help improve the overall security posture of your facility. And now I'd like to turn it over to Ms. Phoebe Nelms to get us started and introduce our featured speaker. Phoebe?
Thank you so much, Tabitha, and good afternoon, everyone. Welcome. I am really looking forward to today's presentation because we have the opportunity to have an engaging and casual conversation with Robbie Morris of ION IT Group. This is exciting because Robbie has over 20 years experience in health information technology, and every time I talk to him, I learn something. He has such deep insight into the challenges that impact healthcare providers. He has personally managed or helped deploy hundreds of EMRs, security solutions, and has managed HIT projects for over 100 hospitals and over 500 ambulatory clinics and skilled nursing facilities. So his experience speaks volumes, and I know you'll benefit from his knowledge and enthusiasm for protecting our patients' information, which ultimately helps protect your practice. So please feel free to ask questions. As Tabitha mentioned, we really want this session to meet your needs. So Robbie, take it away.
Awesome. Thank you, Phoebe. Thank you, Tabitha. Thank you, everyone, for joining this afternoon, and Georgia HITEC for having me. I'm going to try to take a topic that everybody kind of gets a little uneasy about sometimes and break it down into a casual conversation. And Phoebe, as we kind of talked about, please stop me if I go off on a tangent on something that's too technical or that's just a little confusing, as I don't want to leave anybody with any gaps. And as a reminder, please ask some questions, and we've got some questions that were submitted beforehand that we'll address as we go through. So, as Phoebe mentioned, my company is ION IT Group. We are based out of Nashville, just outside of Nashville. And we've been in business for many, many years, and you can see kind of the stuff we do on the screens. I'm not going to read any of that, but essentially we've been in the trenches of healthcare IT for a very, very long time, and we know what it's like to wear multiple hats in a facility, whether it be a practice or a small hospital or whatever, and doing multiple jobs and while maintaining that quality of care for patients. And many of the things that we as healthcare professionals are required to do, stay in compliance with patient data laws while keeping an eye on developing technology and threats, that's kind of tough, right? And so those gaps, that's what my company does. And today we'll be talking about information security. We'll look at some recent breaches that have occurred and hopefully we can learn some lessons from the other folks that have had some problems in the past. So here's my mug. I'm not going to spend any time on that. You can see, I mean, I've been doing this a long time, and I look a lot older now than in that picture. But hey, the stories we're going to talk about with security. I mean, so if people looked at the logs at their edge devices, so the devices on their network or the devices in their network, you would see a whole lot of traffic, a whole lot of things happening all the time that would make that might make some of this help make some of this make sense rather. And so I am an engineer, so I have a tendency that I will talk a little too far down the nerd path. So please, just a reminder to
We'll rein you in if needed.
So first up, I'd kind of like to know a little bit more about who's on the call today. So in your facility, if you wouldn't mind, just click which one of those you think your kind of role kind of falls into. If you're more IT centric or more on the business side or more clinical, and because I can tailor my conversation kind of any direction, and that really helps kind of for the overall experience, I guess. All right, so we're coming in. It looks like we're pretty evenly distributed across clinical and IT folks. All right, very nice, very nice. So
that's a good thing,
everybody.
Robbie. Yeah, because it impacts, this topic impacts everybody. Everybody's part of the solution. So it's great that we have that range there in our response to our polling question.
Yeah, I mean, we've obviously, these conversations have been happening for a very long time. The HIPAA rule and privacy rule, security rule, then the HITEC modifications. Everybody has had exposure to this, kind of regardless of what your role, and that's good, right? Because security is everybody's responsibility. I mean, if you're working for a facility or in a facility and you are exposed to patient data, then it is your direct responsibility to help do this. So yeah, it's great that not just the the bytes and megabytes and petabytes and terabyte folks are interested, because that's just really important, and the financial ramifications are huge on a facility if it's not handled correctly, and of course everybody likes continuing to get paychecks, so that's a good thing. So on the screen you see the kind of meaningful use verbiage, and everybody's read this kind of ad nauseum for a long time, and if you've been involved in the meaningful use incentive program, then you would have seen this, and you would have gone, if you've gone through stage 1 or stage 2, you would have attested to it that you've done a security risk assessment, and if you're participating or considering going in the upcoming macro transition, then it's also, the security risk assessment is also mentioned in there. So it's never going to go away, y'all. I mean, it's important. You can read the news, you can see the stuff on the news, and the people that are continuously having breaches, but really the big ones are the ones that you likely hear about, right? And we'll talk about some of the little ones and some of the smaller ones as well, or the big ones rather. But the law, this is there. I mean, the reason that this came back up in meaningful use and with MACRA is because the government kind of realized that folks probably weren't doing as much as they should. And as technology evolves, it's not like it's not a destination. Security is a journey. It changes all the time. If you put a new PC in, then you introduce a new risk, a threat, into your accessing the PHI. So it's never going to go away. And there's federal laws, of course, and fines, and state laws, and what they asked for in meaningful use and MACRA is literally your testing. Have you done a security risk assessment? And you just did a little checkbox said, yes, I have. Well, that is exactly, y'all, that is exactly like today, right? What is today? Today's the 18th. So tax day, right? We submit taxes. That was 3 days ago, right? Or is it today?
Today.
So that is us filing what to the IRS our federal income and expenses are in our house. So you literally, that tax return is saying, hey, federal government, I have done these things. And this is what I've made, this is what I've spent. This attesting for security risk assessment, it's the exact same thing. You're attesting to the federal government that you've taken the necessary steps to protect the PHI. And of course, there are penalties kind of associated, just like the IRS, right? You get a couple of red flags and they go, hey, we're going to go audit you, and you got to pull every tax or every receipt, you know, for the past year or longer if you're that unlucky, to produce the fact that, you know, I've really done this. Well, this is the same thing. It's not crazy complicated when you look at it, you know, get it in perspective. And Office of Civil Rights are the auditors that do the enforcement on protections and audits, and they have very steep penalties that come with this. So, you know,
are you going to give us an idea of what those penalties, what the range is, just as a reminder?
Yeah, I can. Yeah, so 50 up to $50,000 per record. In a calendar year. I mean, and it can be repeated in a calendar year. So you've had multiple breaches. Potentially, you're looking at $50,000 per record. Now, they now do all. Oh my gosh, yeah. I mean, in a smaller environment, that's just devastating. That's between keeping your doors open or having your doors closed. You know. And, you know, but they don't always enforce the financial penalties. And it's really kind of that, you know, subject to, is it your lucky day or not, right? The Clint Eastwood line. But for certain, there are, you know, audits, there are fines, and you're totally rolling the dice if that happens. And they break out the tiers of fines based upon what your planning are. So if you knew, you know, you've taken some necessary steps to protect your information. You've looked for you've done the audit, you've checked, and you had some gaps, and you fixed them, and then you had the breach. Well, that penalty is far less than if you've never looked at all. Because just completely ignoring it, that's not the right way to handle that. That's your biggest penalties. And just the exposure is just too huge. And as you know, as their workforce grows, and they're continuously hiring auditors, as that workforce grows, then you can certainly expect that some of these audits would just kind of hit you more closer to home. You know people that have had that happen to you. So it's always important to keep your eye on PHI management and compliance. So that 45 CFR 164-308 A1, right? I mean that's legalese, that's government. But what does that actually mean? The compliance management program can be daunting, obviously, right? But at the simplest, what we're talking about is examining your operational policies and procedures and technical vulnerabilities, and then correcting the deficiencies that are found. And how do you know what to do if you don't look, right? You got to look at every aspect of how PHI is handled in your facility. That means under all the nooks and crannies, and not merely just in the four walls of your building, but at everyone that comes in contact with PHI, and documenting the way that your team handles everything and following the policies you put in place. You know, that like looking at the logs. If you've ever looked at a firewall log, it will freak you out. I'm here to tell you. There is information being thrown at our internet connections nonstop, 24 hours a day.
I think you likened it to a shotgun when we talked before. That was a great analogy. That really painted the picture for me. Maybe you can share that with our audience.
Yeah, so you know, I had somebody not long ago tell me, like, oh, they were kind of downplaying the security risk, element of their facility. And he said, well, you're driving down the road, and on one side of the road you've got a $10 million mansion with a security alarm and, patrols and all of that. And on the other side, you've got a shack, kind of like my company. We don't even have a door on there. And who's looking at my shack when there's a mansion right across the street? That is absolutely the wrong way to look at this. So the bulk of these attacks are delivered by a shotgun blast, not a rifle. The rifle is, one bullet. The shotgun shell, it's got, 50 pellets in it. And what happens is these devices that are connected to the internet, whether it's a server, a firewall, a router, whatever it happens to be, they are facing shotgun blasts relentlessly. And if one just happens to get a response, if that one pellet bounces off of something, hey, I got an active device over there. And if you're familiar with how a telephone, right? So everybody's got cell phones now, but back in the day when we all had home phones, you would have a phone number that was attached to your physical address. Well, when you buy internet services from an ISP, they're giving you an IP address, or they're not. They're either giving it to you and it stays static, or they're giving you, just giving you one that changes all the time. But the bad guys, they are just throwing that shotgun shell out there, and if something responds, they will then kind of take the next step at trying to take advantage of that response. And that could be maybe it's taking data out of a network. Maybe it's just borrowing network storage to put music or movies or pirated copies of other stuff right on your servers, or maybe it's just a malware, a ransom attack, and we'll go into more of that here in just a little bit. But malicious files that then wreak havoc throughout the rest of your environment. So it's not necessarily that, oh, well, nobody's looking at me. Well, no, it's indiscriminate. There's no rhyme or reason to how somebody, how this happened. But on the occasion, big, companies will get targeted. And it's not, and the thing that, that kind of makes it difficult when you think about it, a lot of these attacks are coming from overseas. They're not coming from the neighbor's kid who's, or cousin who's angry because somebody lost their job. No. It's coming from Asia, and it's coming from Russia, and because there are no fines, there are no penalties, right? Our laws are not enforceable over there. So the recourse is just minimal. So what's the harm, if I throw something, if we do have a problem? And at the end of the day, if per the law, if you have a breach, and it doesn't even, listen, y'all, pay attention, this is important. And Phoebe, by all means, if I strike a nerve, let me know. In breach determination, this is not, I know I had a breach, so therefore I must do something about it. No. The law says you must report the breach if you suspect that you had a problem. And so a lot of people clearly are not following in compliance with the law because they don't realize that. It's like, no, if you think that PHI has gotten out of your control, you've had a disclosure, and I'll kind of talk about that here in just a few minutes, then by law you're supposed to report that. And that's crazy. So, and this plays hand in hand with the security risk assessment. And right. A breach is generally, that's an impermissible use or disclosure of PHI under the privacy rules. Let me read this because this is important. If PHI is acquired, accessed, used, or disclosed in a manner that violates the privacy rule or considered a possibility of disclosure, then by law it is to be presumed to be a breach. The breach rules require a rebuttable presumption of breach. That is, an entity, as an entity, you got to assume if there was potentially a breach, then you got to treat it like there is one. So this is kind of the opposite of law, right? And when we think of, innocent until proven guilty.
Mm-hmm. So we're feeling kind of vulnerable now. We need some solutions.
Right, and I told you it was going to be that way, right? It's going to make you feel uncomfortable, and you're going to kind of wonder and go, wow, well, how do we do this? So, and when assessing the probability that that PHI has been disclosed, there's federal government lays out 4 factors that have to be considered. What is the nature and extent of the PHI involved, including even if it's anonymized data, what are the factors that can be re-identified, right? Second factor, the unauthorized person who used PHI or whom it was disclosed to. Because what if you disclosed it to another provider in the network that you routinely share to versus faxing something to the wrong fax number and you don't know who the fax number belonged to, right? Or you had some kind of mishap. That's kind of what that's talking about. And then the next thing is whether the PHI was actually acquired or viewed. Did anybody actually see the information that you sent? And at what extent the risk to the PHI has that been mitigated? So again, covered entities and business associates, we all have the burden of proof of demonstrating that we satisfied the obligations following a breach. So burden of proof, right? And if you're not looking at logs and whatnot, then it's going to be hard to know if you're not looking at the logs, right? It's like your health, your personal health. If you don't, keep an eye on your physical, right? That's the word I was looking for. Yeah, if it's physical. If you don't go get one, then how do you know? And we're talking about PHI only, right? We're not talking about personally identifiable information. So, other types, to be a breach, there must be an acquisition, access, use, or disclosure of unsecured PHI. And HHS has been very specific about the definition of that, and it literally is the literal word of that. And they're broad, right? But they are literal. So from HHS perspective, it's like, no, you don't. Not like the rest of the HIPAA law where you're, well, what does that really mean? The literal word of this. Each word is encompassed within the current definition of use and disclosure. It's defined by sharing PHI with entity that needs it. Disclosure is defined as divulging information in any manner outside the entity that's holding the information. So if a breach of unsecured PHI affects 500 or more patients, then the covered entity or business associate must notify HHS within 60 days from the discovery of the breach. So theoretically, if you've had something happen in your network that compromised 500 patients, then you had 60 days to report that. And a lot of people don't realize that there's a calendar. So when thinking about assessing penalties, that can certainly come into come into play. Now, if the breach of PHI affects fewer than 500 patients, then you've got until the end of the calendar year or as soon as possible, right? And they don't. So again, that's kind of like a little flip-floppy of, well, as soon as possible or within the year, and kind of the PI, personally identifiable information. So the distinguishing the difference of PHI and PII. PHI obviously is. Yeah, that's a big deal. That was one of the questions that we had submitted beforehand. PHI is patient information, so that's health, that's their name, their social, that's their any information that relates to their health. PII, in its simplest, the way to kind of wrap your hand around that's like your employee information. So that could be their social, could be their salary. It could be any number of,
street address.
personally, Yeah, right, the personal demographic information. And that's not health information. That's PII, not PHI.
Right.
So you don't
so
have
health
to...
information specifically has to adhere to the HIPAA guidelines.
Right. And if you're looking at the devices or you're having your super nerds, and I do consider myself that, so I say that with all the affection I can muster, have people got to look at the logs because that's how you know if the server that has your EMR on it was accessed or if it's your file and print server where you store your Excel spreadsheets. And if you don't look at the logs, you don't know which one it could be. And God forbid that it was ransomware or malware or something like that, then you potentially could have them both impacted. And we'll talk about that some more as well. And y'all, I see this this question thing, so by all means, if you have questions, please throw them out there. Next up, we have another poll. We have another question. So, are you the compliance officer of your organization or directly responsible for implementing security? And essentially, in your compliance program, you have to name an individual or a role of who has that job. It can't be kind of willy-nilly happenstance, you know. And you got to have that, and you got to have these policies, laid out so that people, so you can follow them and understand that. Okay, so we have a lot of people that have that responsibility. Well, good. Well, I'm glad. Well, hopefully that, as we're talking today, that something, resonates with you and you get something and help. And by all means, I see a question down there, Lisa, and I've got a link at the end that you'll have that, so you'll have that answer that you're looking for regarding the fines. And, why is information security so challenging in healthcare? Okay, so this is talking, it's very similar in health information exchange. Why can't we get HIE? Why is information so security and so challenging in healthcare? I can go to my ATM, I can put my bank card in, and I can get money out anywhere in the country. Somebody can tell me if I've got money. Well, banking has been doing that for 50 years, right? Health information exchange been, 10 years? So we're not as far down the path in some of those in maturity model. And the same can be held true for information security, right? Because when HIPAA came into play, there was just some confusion around the guidance, right, of what you're supposed to do. And they did that by design. I mean, typically laws are not supposed to be ambiguous. It can't be gray. It's got to be black and white, right? I mean, you got to know what the law says. Well, in information security, there are so many ways to get from point A to point B. So the law was not going to say you must install a Windows server and a Cisco firewall. No, it was never going to say that because that's not how the law was written and designed.
That precludes innovation, and so you had to have that flexibility. Is that the reasoning behind that?
Yeah, right. So I mean, they didn't want to put barriers up that prevented that innovation, right? I mean, there's so much. I mean, it's Health and Human Services. They have a very, very large task, very large job, and they're not wanting to, handcuff people before you even get started. And the technology, it changes so fast. And as we kind of go with each new week or whatever, each new day, each new conference, there's always new technology getting introduced in healthcare, and building that ultimate stellar, impenetrable fortress of data security in healthcare, that's almost impossible because everybody, I mean, you're building silos of information, and everybody's got multiple jobs, right? So that can just be very difficult. But in our world of delivering care to patients, their security is everything. and continuously striving to hang on to our daily task and innovate in these very complex technical situation environments, that's tough. And sharing PHI with other providers and VAs in the care continuum, that's becoming more important every day, right? And it's critical in the delivery of healthcare services. You know, and that's only going to continue to grow, right? As more, I mean, everybody that's got a family, if you've got, you know, a spouse and some kids, and you're going to the pediatrician, you're going to the family medicine, you're going to any specialist that you go to, how often are they all using the same system, right? Rarely. And even if they're in the same building, in the same company, they don't always share that same information. So it's difficult. It's difficult, and so it's our you know, all of our responsibilities to kind of look at that and go, well, how can I make it better for my company, and make those suggestions to people. Now, granted, the super nerds, hopefully we don't, you know, go, really? I need you telling me how to do my job again today? But it's the casual observations, right, of helping making our, you could know, I mean, and I can tell you, y'all, we do 500 of these audits a year, and no organization is just completely rock solid safe. That just never happens. But there's obviously some basic elements and things you can do to help mitigate those risks of that exposure. And just like I said, if you're not looking at the logs, then, you know, you're not going to know. So some kind of fundamental low-hanging fruit things. You know, this is this slide you have on your screen. This is most definitely low-hanging fruit. So it's clearly important that covered entities maintain that proper security posture and compliance. But business associates have to do that as well. And depending on your agreement at your facility and what you signed with your business associate, if it lists them as an agent or a contractor, depending on what the verbiage is used, you could be completely responsible for how your business associate uses your PHI. You could have the liability.
Can you give our audience a few examples of what a business associate is, just so they're clear as to what, you know, who they should be thinking about?
Yeah, so, I mean, the easy one is IT consultants. I mean, that's super easy, right? I mean, if we have the responsibility of managing your server and your network, we clearly have access to your PHI. It could be a clearinghouse, a payment clearinghouse. It could be a billing consultant. It could be, you know,
your copy machine repair person?
Yeah, your RICO, right? 60 Minutes did a thing on that, right? Any basically copy machines that had, I'll not go off on a tangent on that, but copy these big all-in-one centers, they have hard drives in them. Well, 60 Minutes did a deal on a segment on this like a couple of years ago about basically everything that you ever scanned on that all-in-one device, it wrote to that hard drive. Well, if you had it on a lease from the local RICO team, and then they come in and take that one out and give you a new one, then you potentially just released every scanned patient record that on that device that just got rolled out your front door. Now that's not unnerving at all, I know. But the point being is that, you know, you've got to look at your business associates, and you've got to have now a business associate agreement. That spells out the terms of your relationship as a covered entity with a business associate agreement. But that is not the only agreement that you have with the business associate. You have another, like a statement of work, right? A contractual service thing that you're doing for them. And who, I'm not going to ask for a question, this is not a poll question, so nobody knows what your answer is, but who on this call has actually asked your business associate for proof that they've ever done an audit, that they've ever looked at their own network and infrastructure So that's potentially a huge deal. And again, low-hanging fruit in the compliance world of, okay, well, we're better today because we asked the business associate how they were protecting our information. And so I would encourage you to, to ask that. I mean, it's, every business hates spending money needlessly, but it's the security of, is the security of your PHI important enough for your BAs that they maintain their compliance program? And no doubt that many do not, and we'll talk about that here in just a minute. But I encourage everybody to ask your BAs the hard questions. Get proof of that technology vulnerability audit or their PHI compliance manager documentation. Perhaps, and we have definitely seen this, ask them to provide a cyber insurance policy that lists your organization as the beneficiary. So if they have a breach, you get paid for it. Because if they have a breach and they haven't done anything and your agreement says that, they're working on behalf as a contractor to you, guess who's responsible for that breach? You are. That's a huge, huge problem. But it's an easy one to remedy if you just ask. And if they have not provided you with some information, then you just ratchet up that request, right? So, but in this connected world, we all have PII, personally identifiable information, that's being transmitted between upline service vendors and all these back-end applications and all this kind of stuff. And there is no way that all this data is always secure or sanitized and or encrypted in storage and rest. And the proof of that is in the news every single day. Every single day. And it's a bit overwhelming and mind-numbing. All right, y'all still there? Then we got a few people that I can see a little sleep icon on these participant thing down here. No, I'm just kidding. There's no sleep icon. But I know this gets hard, and it's certainly unnerving, and we're not done with the unnerving portion of the conversation. At one point, we do get to this spa-type feeling of happy, peaceful, relaxed, but we're not there yet.
I'm looking forward to that.
So, right? We're getting close. We're getting closer. So up on the screen. So this was active. This is a screen capture that I found online from Becker's Hospital Review. It's from February 24th on just recent breaches. And you can absolutely bet that as of April 18th, all those have dropped off, and there's 15 new ones. And it just happens. But the peace of mind, knowing that you aren't losing control of your PHI or other data, that's what we're talking about. I mean, none of the staff or employees of any of these 15 companies on this list, none of them have peace of mind. They're quite the opposite. And at least 5 of those 15 intrusions are from business associates. And again, I know it can be mind-numbing, but an information breach is the breach. And not all of these are from, the gremlin that got in across the network. It could be just as simple as a lost or stolen device. One of those breaches is a patient records, paper records rather, that were not disposed of correctly. So a breach can be a simple human error or a technology thing, and regardless, the law does not designate which one matters and which one doesn't. It's still a breach. It doesn't matter. And all of our computer data is always vulnerable to attack. I had somebody tell me a long time ago, the best and most secure computer is one that's turned off and unplugged. Well, yeah, but then it's kind of like a brick or an anchor, right? I mean, it doesn't really do you much good like that. But if you take nothing else away from what I'm talking about today, this is important. Mine and your personal data is always vulnerable to attack. Always. And so is our patients' and employees' information. Just look at your cell phone, right? And just think of what's on your phone. So looking at these a little closer, Number 4, Redwood City, Verity Health confirmed that between October 2015 and January 2017, an unauthorized third party accessed its medical foundation website that included 9,000 patients. Now, do some simple math. 9 times 50. That's a whole lot of money. That's a whole lot of money. Number 7, an employee in Gillette, Wyoming-based Campbell County Health. It appears that an unauthorized individual impersonating a facility executive contacted an employee requesting W-2 information for all their employees who had taxable earnings in calendar year 2016. Unfortunately, before it was determined the request was fake, the employee released all of that information. I say, somebody walks in carrying a box, wearing brown shorts, brown shoes, black socks, black shoes, and a brown hat. They UPS? No, they could have very, very bad tasting clothes. But do you let them come and go as they want? Yeah, because it might be the new UPS guy filling in for our normal UPS guy. Now, got to challenge everything. And don't take those things for granted if you're not sure. Number 12, Children's Hospital Los Angeles had to notify 3,600 patients that their information may have been on a laptop that was stolen from a physician's car. And they had to report the breach because they weren't sure. Number 14, here's one that everybody may or may not have heard about, Emory. It was the result of a misconfigured web database. So information reportedly included patients' names, addresses, email, cell phone numbers, and the security analysts determined that the database was a victim of a Bitcoin ransomware attack. So essentially, a ransomware attack is where people they get their information essentially encrypted, and they get their information encrypted, and it's kind of held hostage until that ransom is paid. And I'm not 100% sure how Emory is dealing with this at the moment, because normally people don't talk about these things as they're happening, right?
But for us in Atlanta, that's pretty close to home. It really makes us think of how can we avoid becoming victims.
Well, and the chances are likely, like when it's close to home like that, that you know somebody that was involved. If you're not involved yourself, you know somebody that information was there. And who, this is one that I guarantee you people know about up on the screen. Who owns the largest PHI breach in history? Anthem. A couple years ago, they had a doozy. They thought when it initially happened, when they discovered it, that it was only 10 million patients. But in just a few weeks later, that damage, it went to 78 million patient records. Name, social, date of birth, everything. The hackers are thought to have gained access to the network using a malicious program that gave them access to a login credential of an employee. So like a screen scraper thing, right, where you can track everything that's typed into the screen. And they're still not done calculating the cost of this breach. This one is this one's a doozy, and we could talk about this for an hour just alone on this one, because I mean they did not have data encrypted. So if you look at data in your environment, on your hard drive individually, on your server, on your EMR, if these devices are encrypted, then any malicious file that gets into your network, you're putting up that extra wall. That extra wall that's, that they're going to have to breach. They're going to have to get through that wall in order to be successful in the breach. So people, what can I do to protect? What do I do? What's the best thing that I could do? It's a castle, right, and a moat. When you think about the days back in the Knights, right, they had a big moat that went around a castle with a drawbridge, and they'd pull up the drawbridge, and you had to get through the water, and then if you got through the water, then you had to get up that big granite wall. And then you had to go over the wall, and oh no, there's another wall. So they built these walls, these different measures of security, and that's how you mitigate the impact of an attack. You have multiple layers of defense. But in this case with Anthem, if had all of this data been encrypted throughout the process, then you can bet that it would not have been 80 million patients that they got through. And that's a doozy, you know. So you can't really see, but if everybody's not familiar with fear, uncertainty, and doubt, that's called FUD. I'm not trying to do that. I promise I'm not. Because these are all just essentially reporting things, right, from the internet that you can go to the news and you can see and you can read on that. So I'm not pushing FUD, but everybody knows that in today's world, a lot of vulnerabilities are there, and a lot of bad folks are trolling stuff on the internet, causing problems for all of us in some way. But in healthcare, the ramifications are dramatically different. The fines and laws that define how PHI management is supposed to be treated, that's already put out there. And that's not the norm for other industries. And this is due to the ramifications of inappropriate information release that can't be undone if a breach occurs. One of the questions that was submitted to us beforehand was please discuss challenges with health information exchange and mental health substance use disease. Well, so interestingly, there's a group called the Substance Abuse and Mental Health Service Administration, the federal government. And in January of this year, they published their final rule on implementing changes in confidentiality of alcohol and drug abuse patient records. And you go, well, wait, why is that not HIPAA? You know, and I ask myself the same question. Well, shouldn't that already be covered? Well, interestingly, right? So HIPAA privacy rules literally permits the use and disclosure for treatment, payment, healthcare operations, as well as certain other disclosures without the patient's prior written authorization. So if you've got a diabetic patient and they need diabetic socks, you know, and you can send them, you can order them, well, you can bet that oftentimes that the diabetic supply company is going to continue to try to sell services or goods to that patient. And that's completely permissible in the HIPAA privacy rule, not in the SAMHSA world. In the world of health information exchange when it comes to mental health and substance abuse, you cannot disclose any information without the patient's consent in writing on a form that meets the requirements of the regulation. And that is actually one of the downloads, if you look right there in the file section on the screen, that HIE paper final. I don't know which one of our guests today asked that question, but that will help you in a big way, and it certainly did me. And you know, the simple analogy is, you know, an airline pilot taking antipsychotic medications. That's probably a very, very bad thing for him if that ever gets out. Or, you know, a HIV patient that's working in a restaurant. I mean, these are things that you just cannot undo, that can wreck and devastate someone's life. So this additional law that are stricter than HIPAA, that was introduced. And strangely, it was 27 years old, the previous law that they had out there. So they've updated that, and that's super, super strict on how that is handled. And so that's even you know, stricter than the non, you know, behavioral and substance abuse world.
I really appreciate you sharing that research, because it really affects a large percentage of the population, and it really helps them to be more proactive in seeking treatment, because it's designed to really protect them from prosecution or discrimination because they have this diagnosis.
That's right. That's right. And so it's important. I mean, can you share behavioral and substance abuse information on HIE? Of course, but you have to have the patient's consent. Mm-hmm. The patient's got to be the one to agree to do that. And you know, that's just not the same. Same rules don't apply to other patient settings and other care settings. So it is a very interesting question, and I appreciate whoever submitted that, putting that out there. Again, talking about things in 2017 and threats in 2017, one of the big deals, again, we talked about was ransomware. Again, ransomware is one of those malicious files that comes in via email, right, that says, "Thank you, I've got your money waiting overseas." Ransomware just comes in. Ransomware comes in via email, and it, somebody clicks on it, and it pulls that file, executes that file on the local machine, and it can encrypt your whole machine. That was and that's actually what's on this screen here, the crypto locker. And these things are never going away, y'all. They just get rewritten by the people overseas and just reused. So once that code is out in the wild, you can rewrite it and have it do something different. And that's extortion. And there's nothing we can do other than provide accurate defense. The different measures, right? Build the walls around the castle around your information. And so while that is incredibly, a daunting task, there is ways to prevent that. It's an easy way for attackers to try to make money and in mass via the shotgun attack. Next up, we have another polling question. Yeah, how comfortable are you, from these kind of malicious threats? And if there's a nature of, you've got a firewall, you've got antivirus, somebody gets through your firewall. A good example is a VPN. So you've got a VPN tunnel that somebody gets into your network for remote access. Well, do you actually analyze the data that's coming through that secure tunnel? Because it certainly does happen that malicious files just get securely deposited in your network. So the firewall may not even stop it. It just puts it in a secure tunnel. So if you're not doing that advanced, persistent threat using that advanced persistent threat technology, then your firewall may not even stop that. It's a real problem, and people, there are ways that you can protect that. So what do we got? All right, so everybody's feeling comfortable. Well, hey, that's great. Yeah. So yeah, it's not bad. Not bad. I'm glad that you're feeling there. If your policies and procedures and your audits, are exposing those problems, then sounds like you may have already gone through your security risk assessment and you've taken the steps necessary to protect that PHI. How can you help keep your organization secure? So next up, we've got some things for the IT department. So role-based access. Only give users and business associates access to what they need to do their job. Nothing more. Firewalls. Ensure that you've got adequate protection for your firewalls. You can't just install them and forget about them. The logs have got to be reviewed and anomalies investigated, because you may have that jump drive that somebody put on their machine that they found laying somewhere, or they put it in and now it just bypassed your firewall, right? But your firewall's getting banged on because that PC over in the corner is the beacon that's just continuously pushing information out to the internet. Wireless security. This is a funny one, right? So everybody, for those of us that have been in this, HIT world for years, remember a few years back when everybody wanted Wi-Fi, and the executives were like, no, we don't need it. Too many problems. And legitimately, there are still problems with Wi-Fi. But how many people have never checked the security on the Wi-Fi network, right? And I find that always to be kind of interesting that everybody wanted it, and then when the senior staff relented and gave access to it, but yet nobody's checked it yet. And it's more than just a SSID. It's that man-in-the-middle attack and that's not hard to do. And just think about sitting in the parking lot where your PC is broadcasting this information out. Antivirus and malware. You need protection from both of this, and it may not be the same software. And if your desktop support folks are always cleaning up machines, then that may not be you may not have the end all of what you need. Server workstation and updates, Patch Tuesday. Yep, that's a thing. Most manufacturers put them out weekly. Make sure that your folks are patching the devices. And we do hundreds of audits a year, like I said, that you'd be shocked at how many things we see that people just aren't doing this. And the reality is some devices in every network are old, and they shouldn't even be used. So if it's a Windows XP machine, they're not putting patches on that. That device should be replaced because it's never going to have a fix for the problem that it has. Multiple layers of security. Again, the castle walls, right, the moat. There isn't one solution that fixes everything, and a lot of tech solution vendors say that, but it's just not quite possible yet. And how do you eat an elephant? Well, you don't. But if you did, one bite at a time. One bite at a time. And the security solutions need to be the same, multiple layers of defense. So back up your data, right? So ransomware. If you have a malicious attack that encrypts your data, if you don't have a backup, you very well could be trying to recut the puzzle, pieces that just came out of the box, right? That's a very, very bad problem to be in, and you don't want to be there. Backup encryption, data encryption. So if you're doing multiple points of data encryption, you're reducing the risk of that leakage, that data loss. Recovery, plan for data loss, right? It's not just a matter of, I got backups. Okay, well, when have you restored something to it to test the reliability? And, are your business associates, ask them about compliance. Are they secure? And have you looked at their what they've done? So kind of in summary, privacy laws are never going away. Threats will always be there. Protecting data is everyone's responsibility. So thank you again to the clinicians who are on the phone today for taking notice of this and interest in this. Review your compliance management program because, again, it's not just a book that you create and put it on the shelf. If you get audited, you have to show that you've been actively doing something on that. And doing a gap analysis is really how you determine if you're addressing everything you need to address. Your book may have, if it was done 5 years ago and you've replaced some technology or you've put another vendor on your network from your practice, your facility, then it may need to be updated. So it's kind of a living, breathing document. And you hold each other accountable. I mean, and that's a very, again, low-hanging fruit of look around and who's got access to what and ask those tough questions. And if you don't, if you have any doubt, GA-HITEC, perfect folks to talk to about that. They have resources that can help, help fill in those gaps. And here are some links that have some information, including penalties and enforcement, like we talked about, Lisa. There's your link right there. And
Robbie, we have a question that I don't want to cut you off, but I really would love to answer this question. Is the security audit the same as a security risk analysis? I know the answer is no. The security risk analysis is a requirement. So just a little bit about what you mean when you say the audits. The audits have to be done.
Yeah, so a technology vulnerability audit. That's literally looking at your PCs, servers, routers, your devices that plug in, and checking to see if that device has a vulnerability. A risk audit is a technology vulnerability audit is a component of a security risk audit. A risk audit is ultimately what is the risk of exposure. Well, it comprises your wired technology, your wireless technology, and the human element, right, your policies and procedures, and how you do use and disclosure, how you define that, and do you track what you disclose. And most organizations don't, right? I mean, most organizations don't track everybody they release information to. So what happens when that person gets contacted from another provider and they go, wait a minute, who are you? Why are you calling me? Well, you may have just disclosed something to the wrong person. So a security risk assessment helps you kind of look at all of those pieces and determine where the holes are, right? Where things that you need to shore up to make certain that
So you patch the holes in your around your castle. You make sure that you discover what they are. Mm-hmm.
Right, the little bitty hole versus the big cannon hole, right? I mean, that's what you're looking at, and there's not, as I said, there's not one thing that one solution that solves everything. So you got to go through the security risk assessment to know, where because the human element is the big part of it, right? I can secure the computer. I can lock it down. I can make sure that nothing is coming out of that device. But the first time somebody, well, actually, one of our questions that we had submitted beforehand, it was a student. Let me find that real quick. If a medical student takes a picture, yeah. So we had questions, as I mentioned before, and I know we're coming up on time, and I apologize. One of the questions that was submitted to us, if a medical student takes a picture of a patient's electronic health record with their smartphone, is this a violation of HIPAA? Well, clearly it increased your risk, right? Is that person's smartphone yours or theirs? Because if it's theirs, now your PHI just walked out the door with that student on that smartphone. Now, is that student ever coming back, or do you have some kind of an agreement with them? Well, for certain, anybody that comes into your facility that's looking at PHI, you need to have them sign something that says what they're going to do and not going to do. And that is a prime example of have they, what was the reason that they did it, and what are they going to do with it after they've done that. And that's just increasing risk unnecessarily. So let me kind of just browse through this document real quick. Best practices, we addressed that. Multi-layered defense, right, for security. What is the best protection? Totally depends on the threat, right? I mean, multi-layered defense techniques we talked about, and somebody's got to review the logs. How pervasive are threats? They're very real. Everyone is a target. We kind of talked about the shotgun analogy versus the rifle analogy. Just luck of the draw. It's kind of like winning the lottery, in a bad way, I guess. How do you plan to protect patients' info with this new repeal of privacy from ex-President Obama? HIPAA was around before the Affordable Care Act, and HIPAA will be around after the Affordable Care Act if that's what they do. Regardless of what D.C., the powers that be in Washington, D.C. do on this, you can certainly expect HIPAA to remain in full effect because it's ultimately, you don't throw the baby out with the bathwater, right? I mean, they don't, hopefully they don't anyway. That would make absolutely no sense. But, could have happened in the past. Some things make sense, some things may not. Best way to protect your PHI, have an up-to-date protection plan based on your environment and modify it if you made changes. And like I said, it's a journey, not a destination. Do you need cyber insurance? My answer to that, I gave a brief statement on it from the business associate perspective, but you buy as much insurance based on what you can afford, right? Phoebe and I were talking kind of beforehand, and I said, if you've got your Hyundai and you're driving around the neighborhood or the city, you've got insurance on your Hyundai, but do you have enough insurance on it to protect that Bentley that you just rear-ended? Well, yeah, you can buy insurance to protect that Bentley, but did you? Most people don't, right? That's just not the level of insurance that people carry. Cyber insurance is the same way. You can get cyber insurance that protects you from known things, known problems, and you can also get a cyber insurance policy that protects you from anything. Well, which one of those do you think is more expensive? The one that protects you from anything, because the insurance underwriters don't know what the parameters are of this risk and expense kind of deal. Then if there's any other questions on that, certainly, I'm not an insurance person, but I can certainly talk to more about that. Is text HIPAA safe to use and communicate with members when no other options available? I don't. This is important. I don't do it, but others do. So no, it's not secure. You never text in PHI because text is clear information, clear text. Now, it's not an intermediary, so somebody in the middle that grabs that information on the way through. Well, like your cell phone company, right? I mean, if you're texting information, have you got the agreement signed with them that says that they're not going to misuse that information? No, you don't, because most companies won't even sign that. So no, that's never good to do, and you always discourage that with people that are doing it. And email is the same way. Straight up flat email, that's even easier to get in the middle of, because anonymous email servers, right? So I have got an email server, you got an email server. We didn't do anything to configure our servers so they can communicate with each other, but they do, right? It's just how it works. Sending email is the same. That's worse, because now I can literally get in the middle and I can eavesdrop just by turning on a service on my firewall. I can listen to everything that's going by. So that's a big no-no. How can you ensure email privacy? Well, you fortify the walls around it, right? If you're gonna transmit PHI via email, there is a middleware solution that you can put in that helps control that, right? But certificates kind of help get that there. How can we better protector PHI? It's a castle, right? And everybody's responsibility. PHI, we've identified that. Cloud-based systems, offshore and offshore. So this is an interesting thing, right? So if it's an offshore cloud company, they don't have HIPAA rules. So you're potentially storing information on a cloud company that's not covered by HIPAA. You're still covered by HIPAA, but they may not be. So you got to look at those vendors very, very carefully before doing that.
I think we might be
at
the limit of our time. Robbie, this has been so informative, so educational. I just really appreciate all the valuable tips that you've given us and how you've helped us to really think about this in a way that will help us protect our patients and our practices. It's just wonderful to have somebody with the insight and the knowledge base that you have, the experience, the expertise, and the passion for sharing that. I just really am thankful that you were with us today. So I see your contact.
You're very welcome.
On the screen, and I hope that our participants will feel free to reach out to you and utilize the wonderful resources that you can make available.
Thank you. Thank you guys again for having me this afternoon. I appreciate it, and I appreciate everyone's time and attention and hanging on with us.
Awesome. Thank you so very much, and everyone have a wonderful afternoon.
Well, before everyone hangs up, thank you so much. We just want to thank everyone for attending today's presentation, and we hope that you found it to be an enjoyable learning experience. We'd also like to extend a special thank you to our speakers, Robert Morris and Phoebe Nelms, for providing such valuable information. Their contact information is on the screen at this time. Again, please feel free to reach out to them with any other questions you may have about today's topic. And again, today's presentation is brought to you by Georgia-HITEC at Morehouse School of Medicine's National Center for Primary Care, a national resource supporting primary care professionals serving in underserved areas. We also want to give you a last reminder to please save the date for an upcoming webinar on Tuesday, May 16th. Please be sure to join us for that exciting event where we'll discuss maximizing your EHR and information technology investments. We also want to get your feedback about today's presentation, so please check your email later today for a quick evaluation about how we can better serve you in the future. And thanks again for joining today's presentation. We hope you have a great afternoon. Thank you.